name is Francis Santos, and I'm going to be performing a head-to-toe assessment on you today. Nice to meet you.
Nice to meet you.
Can I have your name and date of birth, please?
It's Rick Santos, and it's 10/11/1967.
Excellent. Now, before I begin, I'm going to go ahead and wash my hands for a minimum of 30 seconds before beginning the head-to-toe assessment. Now, the first part of this examination is going to be assessing your head. So I'm going to go ahead and check your palpebral fissures. They're equal and symmetrical. So are the nasolabial folds. They're also equal and symmetrical. I'm going to go ahead and palpate the scalp to check for any lesions, missing hair, patches, any lumps or bruising that may be undiscovered. Do you have any pain or tenderness as I do this?
No.
Excellent. Now I'm going to go ahead and palpate your temporal artery. Excellent. Excellent. Now I'm going to ask you to please smile, puff out your cheeks, clench your teeth. Excellent. Wrinkle your forehead and shut your eyes tightly. Excellent. That was just to assess your cranial nerves 5 and 7, and they all seem normal. Now for the next part of this assessment, I'm going to go ahead and assess your eyes. So I'm going to go ahead and sit down, and I'm going to have you please follow my hands. I want you to look directly straight at me. However, with your eyes, just follow my hand movements. Excellent. Very good. Now I'm going to go ahead and test your visual fields for consultation. So I'm going to ask you if you can please cover your right eye with that piece of paper, and I'm going to cover my left eye. Now as I move my finger, I want you to let me know when you can no longer see it.
There.
Okay.
There.
Okay.
There.
Okay. Now please switch to the other eye. Thank you.
There. There. There.
Okay, excellent. And that was just to examine your peripheral vision. Now I'm going to go ahead and check your pupillary response, both direct and consensual. So if you could please cover your left eye. I will be shining a light, so there will be a light. Thank you. Can you switch eyes, please? Thank you. Now can you please do the same thing? I'm going to shine a light and just watch the reaction of the opposite eye. See? Good. Excellent. Thank you. Now I'm going to go ahead and perform an inspection of your ears. I want you to let me know if you have any pain or tenderness in either ear. Do you have pain or tenderness when I pull?
No.
Okay, what about back here?
No.
No. Good. Any pain or tenderness?
No.
No. What about back here?
No.
Excellent. Now I'm going to go ahead and inspect your nose. Patient's nose does not seem abnormal. Do you have any difficulty breathing throughout the day?
No.
No. Do you have any pain when I touch here?
No.
What about here? I'm going to go ahead and close one of your nostrils, and I want you to breathe in through the opposite one. Take a deep breath. Excellent. Do it again, please. Excellent. Now I'm going to inspect your mouth. I'm going to inspect the patient's lips. I know any cracking or any lesions Do you have any pain or discomfort throughout the day with
No.
your lips? No. Do you mind opening your mouth for me, please? Check the patient's gums and teeth for any loose or missing teeth, any signs of gum disease. Okay, now I'm going to ask you if you can please open your mouth wide, stick your tongue out and say ah. Patient's gag reflex is intact. Can you open it again without saying ah? Stick your tongue out. Excellent. Patient's pharynx is also intact. Now I'm going to ask you to please stick your tongue out. Excellent. Can you press against the inside of your right cheek? And now the left cheek. Excellent. Patient's tongue movements are within normal limits. Now I'm going to go ahead and inspect your thyroid gland and palpate your neck region, okay? The thyroid gland can be located in the middle of the trachea, so I'm going to go ahead and press on the patient's side while palpating. Can you please swallow? Excellent. Now I'm going to do it to the opposite side. Can you please swallow? Excellent. Okay. Do you have any pain or discomfort when I perform that?
No.
Good. Okay. Now I'm going to go ahead and palpate your nodes. You just slide up in the chair, bring it forward a little more. Thank you. Good. I'm going to auscultate the occipital. Okay. Post-auricular. Pre-auricular. Tonsillar. Submandibular. Submantle. Anterior clavicle. Posterior clavicle. Excellent. Do you have any pain or discomfort when I perform any of these?
No.
Excellent. Now I'm going to go ahead and auscultate your carotid artery. I'm going to auscultate it first, and then I'm going to palpate, then I'm going to auscultate your arteries. Excellent. Excellent. I'm going to go ahead and auscultate. Can you please take a breath and hold it? Excellent. The same thing, please. Excellent. Okay. So, thank you for your patience. Now we're going to go ahead and continue with the next part of the examination.